Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about yeast infections in pregnancy. So yeast infections are a little more common in pregnancy than not because your immune system when you're pregnant is a little reduced. They're also more common if you have diabetes or diabetes of pregnancy. They can obviously be very uncomfortable and they can cause significant discomfort and irritation. They can be treated, but there's conflicting information about treating them with medicine in the first trimester, more so with the oral medicine than with over-the-counter. But it's not clear the type of infection you have if you just self-diagnose. So if you're having those symptoms because you may have another infection that's mimicking it, or a bacterial infection, or an STD, or an allergic reaction, it's really important to discuss with your physician. An untreated infection could lead to miscarriage early on, or preterm labor, early delivery. That's not to say that a yeast infection by itself is a super large risk, but we don't always know just from your symptoms. So rather than just going to the drugstore and getting an over-the-counter treatment, it's good to get your healthcare provider in the loop to describe the symptoms and decide whether that's warranted or whether something else is warranted. It may also be a sign of, if you're near term, losing your mucus plug, and you might confuse it that way, or preterm labor, and that your mucus plug is mimicking those symptoms. Or it might be some other infection that could be harmful to your pregnancy or for you. So the whole take-home story is, yes, you can use over-the-counter medicines. Yes, you can use fluconazole diflucan, which is the oral medicine, depending on the circumstance, but involve your practitioner early on to get the best advice for your particular circumstance. Also, do a good job of controlling your glucose if you have diabetes. That will be helpful too. I hope you found this information useful. Thank you.